know too much about Medicare. All I know is I saw it on my paycheck being deducted for the first time, and I wasn't sure what it's going to.
I'm 61, and I'm really counting on Medicare being there for me, especially after what happened to our retirement savings in the last few weeks.
I am on Medicare. It's working pretty well, except the past year with the rising costs of everything. I've had to dip into my retirement savings so much. I'm wondering if it's going to run out.
Probably over 10 years. By the time I got 65, there would be no Social Security for me, and there would be no Medicare.
I'm really concerned about businesses taking less of a role in people's lives in retirement. My dad was a blue-collar worker. He had a fine pension. He had all his medical paid up. I'm a white-collar worker. Was losing money on the job, not getting raises, making the cost of living.
I think there needs to be more accountability, and the government's proved themselves to be real poor money managers.
The healthcare companies and the pharmaceutical companies have taken control of the process, and that we're all paying for that. And I think that our politicians in Washington understand what's going on, and that their vote is not controlled by what we want, it's controlled by lobbyists.
I personally like the idea that we have Medicare. I think it's one of the greatest programs that ever came in for older people.
My parents are both receiving Medicare, and without it, I think I would probably be homeless trying to take care of them.
Healthcare is critical for everybody. You know, we need to have it there when we're ill, and we need to have something in place that's going to carry our generations forward.
I don't want it to become a broken promise, either for myself and my husband or for my children and grandchildren.
I'm also very concerned at, how we're currently going to continue paying for it. Will benefits be available for me, and what programs are going to have to get cut, like education and other things that will be important for my children and my children's children.
What we need is not less government, it is more responsible government.
Better negotiation of costs to bring costs down with the drug companies, with the hospitals, not just drug prescriptions, but all places.
We liked the idea of the health savings account, not to replace anything that you're doing with Medicare, but as a tax-deductible benefit that you could therefore put away, and that might be useful to supplement your Medicare.
If you provide me the opportunity to save more money now, tax-free, in my own account, when I am of the age to be on Medicare, maybe I won't need Medicare because I can afford to pay my own way.
Individuals should choose to opt in or out of Medicare and to adjust their coverage on a yearly basis. Getting government vouchers back and being able to use that money on private insurance is what we would favor.
Okay. If you get to be 65 and you really physically are like 45, maybe you could opt not to accept Medicare.
Raise the minimum age to 67 years old.
More preventative programs like, making people fit and healthy so that way the costs, towards the end of your life aren't as high.
Mandatory is a little scary to me. I think, though, an incentive to get people to lose weight or quit smoking, but for them to say to you, you're not covered if you don't quit smoking.
AARP hits you at 50 already. Maybe Medicare should start, putting their money into education and prevention earlier.
We felt that there needed to be an independent citizen advisory board.
We don't want Congress doing it because, frankly, we don't trust Congress. We look at that as a way for them to cut benefits. We want to maintain the benefits, but we would like a citizens board that would review changes in society, changes in technology, and make recommendations to how the coverage should change.
I mean, a lot of these changes we can implement, but unless there's some sort of committee or some sort of oversight entity making sure that those monies are actually going to where we're allotting the funds, it's all for naught.
We would have a sliding scale for Medicare based on income, so the wealthier people would pay a higher percentage.
We want to pay for it by increasing the federal sales tax and also a gas tax.
Increase taxes for unhealthy products, similar to the cigarette taxes.
Part of the key to making sure that that works is making sure that the tax dollars that are raised, extra dollars, are spent on health care and are not spent, for example, on the military.
We have to raise taxes to pay for Medicare, but we also have to control the cost. It's not either or, it's both.
If you're going to be on life support and in a coma for the next 6 months of your life with no quality of life whatsoever, it's a matter of
at some point, Medicare's got to say, well, wait a minute, there are, hundreds of other people that could be benefited by the dollars we're spending to keep you on life support.
Quite frankly, we're not talking about my future. We're talking about your future. And you have to decide, do you want to get the same kind of care that I'm getting now, or do you want to lessen that degree of care?
I was impressed by the people in the room. It's a great cross-section of America. They're very hopeful people, honest people, working with each other.
Despite all the differences, I think there was a lot more agreement in this room than disagreement on a lot of fundamental principles, and I think that's encouraging.
It doesn't matter what age you are, but I think at some point you or somebody you know might be affected.
We've shared a lot of ideas today, and I think once this report is presented, it's time for decision makers to start putting words into action.
We pay out a lot, the government pays out a lot. The doctors in the hospitals are not getting rich. I'm convinced that it costs a lot because the health insurance companies and the drug companies are making an obscene amount of profit. And we need to tell them that we don't mind paying, we just don't want to overpay.
I think all of us are willing to make sacrifices for a long-term fix, as long as we have a say in that decision.
After this discussion today, yeah, I'm more apt to say, yeah, I'll spend 20 more cents on the dollar, You asked me before today, and I'd be like, what? Are you crazy? Right? Because I didn't know. You see what I'm saying? Not everybody in the United States is doing this.
Let's not wait like the financial bailout to wait till we're in catastrophic, dire straits. Our economy is bad now. Let's fix this now. Let's get a system that will carry forward another 50 or 30 years. Don't put a stopgap on it. Don't put something that's going to work for the next 10 years. We need to come up with a plan that is going to help my children, my children's children, and beyond.